Mr. Schneider, if somebody's in this country without permission, should they be allowed to get health care on the backs of the American taxpayer, yes or no?
If people need health care, they should receive it.
So you think that somebody who is here illegally should have their health care paid for by the American taxpayer?
So we have a law in this country.
No, I'm just asking you, that's a simple yes or no question. Somebody's in this country.
I agree with
somebody's, let me just restate it. So
yes, if they need emergency care, yes.
Mr. Schneider, if somebody broke into your home, would you make them dinner?
No, I would not.
Why not? They need help. What if they're starving? What if somebody broke into your home who's hungry? Would you not feed them? Or would you call the police and get the heck out of the house?
If somebody was hungry and needed to be fed, I would feed them.
So if somebody broke into your house, you will feed them. Don't give anybody your address. This is why you keep losing in rural America. You get absolutely crushed because of that kind of philosophy.
A heated congressional hearing just turned into a major political showdown over one question. Should American taxpayers be responsible for healthcare costs connected to people who entered the country illegally? The exchange quickly became more than a policy debate. It became a clash over immigration, government responsibility, and the future of healthcare in America. One lawmaker argued that taxpayer-funded programs must prioritize citizens first. Another warned that healthcare cuts could put millions of vulnerable Americans at risk. But behind the heated words, there are bigger questions that still remain unanswered. Who will actually be affected? Will these changes save money or create new problems? And can both sides find a solution before the political battle gets even bigger? Stay with us, because the final moments of this hearing reveal the deeper divide shaping America's healthcare debate.
Thank you, Mr. Chairman. Thank you for having this hearing. There's an expression in sales that says facts get in the way of a good story. And obviously the Democrats want to stick with the story that Republicans are somehow for billionaires and they're for the working class, but obviously the facts are completely the opposite of that. Talking about rural America, they get wiped out in rural America. Rural American voters reject Democrats by wide margins. You would think that they would look at that and go, well, why is that? So let me give you a little bit of the answer. Your policies have destroyed American manufacturing. You allowed these jobs to get shipped overseas to China, Mexico, and our factories and places in Ohio got wiped out because of those policies. President Trump has put tariffs in place, which have brought these manufacturing facilities back to the United States of America, and yet they fought tooth and nail every step of the way on tariffs. You allowed drugs to come into our border, across our border with impunity. We had a completely wide open border and allowed tens of millions of people to enter this country. Cheap labor, that doesn't affect billionaires. I don't think billionaires get replaced by illegals crossing our border, but working Americans do. They see massive wage suppression. And so those are the policies that they've put in place. And they actually shut down the government and wanted, one of the ransom notes was to get rid of the Rural Hospital Opportunity Fund. They wanted to eliminate it. None of them voted for it, and they wanted to eliminate it. Those are just facts. The ranking member talked about the mom with 2 kids. We're the party that cares about the mom with 2 kids. We're the party that gave that mom a $2,000 child tax credit. You voted against that. We gave that mom an $1,800 child tax credit. You voted against that. If that mom worked for tips or overtime, you voted against that. You're the one that wants to give able-bodied adults more money than those kids that mom has. I think a little self-reflection on that should be part of the equation. That those 2 things, just those 2 things, the child tax credit and the daycare credit, is $3,800 for that mom making $25,000 a year. That's real money that you guys did not want to give that mom. That was just your votes, and those are just facts. But when you did have control of Congress and the White House, what did you do? Did you help working Americans? No. You passed a law that gave $7,500 to the wealthiest 0.01% of Americans to buy to lease luxury electric vehicles. So while the mom with 2 kids is making $25 grand a year struggling, The person making tens of millions of dollars a year could go into a Rolls-Royce dealership and get $7,500 thanks to each and every one of you to lease a Rolls-Royce Spectre. Congratulations on that phenomenal policy. Mr. Snyder, if somebody's in this country without permission, should they be allowed to get health care on the backs of the American taxpayer, yes or no?
My own view is if people need health care, they should receive it.
So you think that somebody who is here illegally should have their health care paid for by the American taxpayer?
So we have a law in this country.
No, I'm just asking you. That's a simple yes or no question. Somebody's in this country.
I agree with
somebody's. Let me just restate it. So
yes, if they need emergency care, yes.
So the taxpayer, the United States of America, should pay for the health care of people who broke into this country illegally.
That's what Congress decided in 1980.
No. Congress never decided. No, what Congress you're talking about. If you needed emergency health care and you went to any other country on earth, would you get it for free?
Well, the countries that I've gone to, yes.
You'd get health care for free if you went into a, so for example, let's take Spain, which has incredibly difficult visa standards. If you went to Spain and needed heart surgery, you think the Spanish government would give it to you gratis?
I can't speak to Spain.
But do you think but it's interesting. I wonder if my Democrat colleagues would agree with that. That if people who broke into this country illegally should get health care. Mr. Snyder, if somebody broke into your home, would you make them dinner?
No, I would not.
Why not? Why not? Why wouldn't you? They need help. What if they're starving? What if somebody broke into your home who's hungry? Would you not feed them? Or would you call the police and get the heck out of the house?
If somebody was hungry and needed to be fed, I would feed them.
So if somebody broke into your house, you will feed them. Don't give anybody your address.
So
whatever you do, I'm asking you just for your own personal sake, do not release your address.
Can I answer the question?
You can, please.
Somebody breaks into my home and they're hungry. I'm going to forgive them for breaking in. I'm going to feed them, and then we'll work out accountability for what they've done.
Okay. Like I said, don't release your address. But on behalf of the American taxpayers, especially the hardworking men and women of this country, no, government benefits, taxpayer dollars should be absolutely and exclusively reserved for American citizens. And so the party that says they care about working Americans, this is why you keep losing in rural America. This is why you guys get wiped out in places like that. Whether it's Virginia or Oregon, you do not win in the rural parts of your state. You get absolutely crushed because of that kind of philosophy.
Senator Merkley would like to make a comment.
Thank you. Just for the record, undocumented individuals are not eligible for Medicaid unless they're in emergency, going to the emergency room under very limited circumstances. And yes, those same services, emergency, are provided by many other nations if Americans are traveling abroad for an emergency service.
Mr. Blaze, very quickly, how many illegal immigrants do you think are on Medicaid? Not beyond emergency services, but on Medicaid. Do you have any estimate? In California?
In California, it's considerable. California got one of these provider tax schemes approved, and then the next got $10 billion in federal funds without any state contribution, and the next year expanded Medicaid to all unauthorized immigrants in the state.
Senator Lujan.
Thank you very much, Mr. Chairman. Coming into the hearing at the moment that I did really caught my attention as my colleague departs. You know, some of us are Catholic, and my colleague went to Catholic high school, I believe, if I'm not mistaken, someone that should understand the lessons that are taught to us every day. I'd refer my colleague from Ohio to teachings under St. Francis of Assisi if he needs to learn about what it means to shelter those that need some help, or provide food to those that need some help, or care for those that need some help. I grew up in a rural community. I didn't have a Rolls-Royce dealership. I still live on a small farm. I put diesel in my tractor. I turn dirt every day. I fix fences. When my neighbors need help fixing a fence, I go help them put that fence up. I don't ask if they're Democrat, Republican, whatever it may be. We do it. this lesson about how the big, beautiful bill, a piece of legislation that President Trump ran on, that my Republican colleagues are trying to fleece the American people in convincing them that this bill helps them. $1 trillion was taken out of healthcare. How the hell does that help anybody? I'm a stroke survivor. 4 years ago, I had a stroke. What I learned is time is not on your side if you have a stroke. You need to get to the doctor immediately. Well, not in the case of what happens with the $1 trillion cuts and Medicaid facilities start closing and rural clinics start closing. And if that was not enough, then they went and devastated food programs in America, kicking farmers and ranchers in the teeth and closing rural grocery stores. That's the big, beautiful bill. They just voted on it. Facts are funny. Anyhow, this hearing is about Medicaid. The realities around Medicaid. If I'm not mistaken, the big, beautiful bill removed about $1 trillion from healthcare, more than $800 billion of federal Medicaid dollars. And my Republican colleagues profess that they did not cut, they being Republicans, did not cut Medicaid. They only transferred the cost to states. They eliminated $1 trillion in access to healthcare. Medicaid programs across the country, we don't know who's going to get care or who's not going to get care. I have constituents writing to me every day about a concern of being able to pay bills, trying to figure out if they're going to be able to get access to care or not. Dina from Bernalillo County, which is the largest county in New Mexico populace-wise, said, as I was sitting in urgent care this weekend, I started to have serious anxiety that next year I might be without my Medicaid insurance and I may not be able to go to urgent care if I needed to. When the Affordable Care Act was passed, we had a Republican governor in New Mexico that did the right thing and embraced Medicaid expansion. It took New Mexico from one of the most uninsured states in the country to a state that actually people could get some coverage and have some certainty that care was going to be there. Democrats and Republicans should be working together in all these. If we're going to talk about reforms, let's talk about smart reforms. Let's talk about ways that we can get care to people in the most effective manner possible so that if someone out there has a stroke like I did, they're going to live and they're actually going to recover the way that I did. Because my recovery is also very unique. I was very blessed with that recovery, but it's because I had access to care. 8 million Americans have already lost healthcare coverage, including nearly 4 million who lost Medicaid CHIP, the Children Health Insurance Program. Now, Professor Schneider, are children protected from Medicaid cuts, as my Republican colleagues have suggested?
Over time, the large withdrawal of federal funding, close to $1 trillion over the next 10 years, that's in H.R. 1, everyone in the program is at risk.
How about
children, people with disabilities, seniors, people in rural areas, people in urban areas, the providers that serve them, they're all at risk.
You anticipated my next question about seniors. I appreciate that response. I did not hear you specifically mention this, people with disabilities. I heard you say everyone, but what about people with disabilities?
Exactly the same situation. The states were expecting the resources that had been in place before H.R. 1 was enacted, and over the next 10 years, they're not going to have those resources available.
Now, coming from a rural community myself, hearing the question from my colleague that was speaking before me, are adults and children in small towns and rural areas more likely than those living in metro areas to rely on Medicaid CHIP for their health insurance?
Medicaid is a slightly more important payer for families and children in rural areas than in urban.
It's
important in both, but it's a little more important in rural.
I appreciate it. Well, this hearing is not on SNAP. The same holds true for SNAP as well. So, look, Mr. Chairman, I certainly hope as the budget reconciliation debate is continuing on Budget Reconciliation 3, we're looking at access to health care. Costs are going up. You know, some folks try to refer to this as affordability. People just can't afford to get services and to get by. And that we should not forget about Social Security. I challenged my Republican colleagues at the last hearing we had on Social Security. Maybe in your next budget reconciliation bill, we'll actually see some language in there to make sure Social Security is solvent. And it didn't happen. Well, Lo and behold, there's another budget reconciliation coming forward. So I look forward to seeing how Republicans are going to protect Social Security and make sure that it's going to be solvent in the next budget reconciliation package as well. I appreciate all the...
What you just watched raises some serious questions about one of the most heated debates in American politics right now, where the line should be drawn between providing essential services and protecting taxpayer resources. The exchange in this hearing was not just about Medicaid or emergency health care. It was about a much larger political argument that has divided Washington for years: immigration, government responsibility, and who should ultimately pay for public programs. The most striking moment came when the discussion turned into a direct moral and political challenge. One side framed the issue around law, citizenship, and the responsibility of government to prioritize American taxpayers. The other side argued that access to emergency medical care is a basic human responsibility, regardless of someone's immigration status. And that disagreement reveals the core divide. This is not simply a debate over numbers. It is a debate over competing values. Supporters of stricter limits argue that taxpayer-funded programs must have clear boundaries. Their argument is that government resources are limited, and elected officials have a responsibility to make sure American citizens and legal residents are not pushed aside. During the hearing, one lawmaker connected this issue to broader concerns about wages, border policy, and the impact of immigration on working-class communities. But opponents pushed back, arguing that the conversation cannot ignore the human consequences. They pointed to the role of Medicaid in rural communities, among children, seniors, and people with disabilities. Their concern was that reductions in healthcare funding could affect vulnerable Americans who depend on these programs every day. That is where the larger political battle begins. The disagreement is not only about undocumented immigrants. It is also about the future of healthcare in America and how much responsibility the federal government should carry compared with individual states. One of the biggest questions raised during the hearing was whether proposed healthcare changes would actually reduce unnecessary spending, or whether they would simply shift costs somewhere else. Critics argued that transferring financial responsibility to states could create pressure on local hospitals and rural clinics. Supporters argue that reforms are necessary to control government spending and ensure programs remain sustainable. Both sides are presenting a different vision of what government should do. Republicans in the hearing emphasized personal responsibility, immigration enforcement, and protecting taxpayer dollars. Democrats emphasized healthcare access, community impact, and concerns about people losing coverage. But beyond the political arguments, there are several unanswered questions that will likely continue shaping this debate. First, what specific groups would actually be affected by any future Medicaid changes? The discussion included broad warnings about possible impacts on children, seniors, people with disabilities, and rural communities. But the final outcome depends on how policies are written and implemented. Second, how will states respond if federal healthcare funding changes? Some states may make different choices than others, creating a situation where healthcare access could vary significantly depending on where someone lives. And third, can lawmakers find any middle ground? Because while both parties strongly disagree on solutions, Americans across the political spectrum continue to worry about the same basic issues: rising healthcare costs, hospital closures, and whether families can afford medical care when they need it. This hearing also shows something important about modern politics. Many debates in Washington are no longer just policy discussions. They are battles over identity, values, and trust. For one side, the message is that government must put citizens and taxpayers first. For the other side, the message is that a wealthy nation has a responsibility to make sure people are not denied critical care. The challenge for lawmakers is turning those competing ideas into policies that actually work. It is also important to separate what was proven in the hearing from what remains political argument. The lawmakers made strong claims about the effects of immigration policies, healthcare spending, and previous legislation. Some statements reflected political viewpoints and interpretations, while others referred to specific laws and programs. The long-term effects will depend on implementation, economic conditions, and future decisions by Congress and state governments. What happens next could become a major political issue heading into future elections. Healthcare has consistently been one of the issues that can change voter opinions because it affects people personally, whether it is a family member needing treatment, a rural hospital trying to stay open, or a worker trying to afford insurance. This debate is far from over. The questions raised in this hearing will continue. How should America balance compassion with responsibility? How should taxpayer-funded programs be protected? And how can lawmakers ensure that healthcare remains available without creating unsustainable costs? Those are not easy questions, and they do not have simple answers. But one thing is clear: the fight over healthcare, immigration, and government spending will remain one of the defining political battles in Washington. What do you think? Was this a genuine explanation of the challenges facing America's healthcare system, or are there still major questions that need answers? Share your opinion in the comments and subscribe for more political updates and analysis.